Welcome to Skyscape's webinar, SkillsHub Learn, Practice, Quiz. I am your host, Kristen Snowden-Smith from Skyscape. Our speaker today is Karin Sherrill. Karin has been a faculty educator at Maricopa Community Colleges in Phoenix, Arizona for over 20 years. She developed the skills content for Skyscape Skills Hub. Today, Karin will talk about the Skills Hub app and how she developed the content and how you can also develop content. We will have a question and answer session at the end of the webinar, so please type any questions you have during the presentation in the chat window. This webinar is being recorded and will be available later this week at skyscape.com/webinars2015. I will now hand the floor over to Karin.
Thank you, Kristen. I want to welcome everybody today, and I really appreciate your time. I recognize, during the school year we're very busy. During the summer we enjoy our time off. So I commend you for being in attendance today. I think you're going to find this time very valuable. Skyscape has always been very creative and on the cutting edge of the most creative ways in which to apply our knowledge to our students in the handheld format. And this particular product that's been developed is going to do that and even so much more for our students. Some of the components to talk about include the overview of the app itself. We're going to talk a little bit about the development of the content, how it is that the content within the application was developed based upon various evidence-based practices. We're going to take a look at the Skills Hub, and we're going to look at it from a learning standpoint. Students are able to use this tool in order to better learn and solidify their knowledge presentation. It can also be used as a tracking tool, and students are able to track not only their practice, they're also able to track in a clinical setting how it is that they're performing. Instructors are able to use this tracking mode in order to keep track of how students are producing, how they're demonstrating their skills, and how they're improving their skills as the more they're using this application. We're also going to look at the assessing mode, where we're going to be applying the knowledge of skills to the Nclex blueprint, to the Nclex test plan, and exposing students to some higher level application and analysis level items. We're going to demonstrate how you have control of this, and one of the most exciting components of this application is your ability to edit and author your own skills and really fine-tune this product to be what it is that your program needs for your students. Taking a look at the overview, I think there's many different reasons why Skills Hub is going to be important for your students' learning. I look back over the years that I've been teaching skills to students, and the traditional way is that we have a day in which we're demonstrating and students are practicing, and within one single 4-hour, 6-hour, 8-hour day, we're cramming all this knowledge into the student's head, and we're expecting them to be practicing a lot of times independently, and they're having to perfect this knowledge on their own. But then we very quickly will move them into a testing setting. And this way in which to practice skills, to learn skills, to apply skills is not always successful. I remember this semester that we decided we were going to be really creative, and we opted to go ahead and teach our IB skills up front. We chose to skill test students in the lab prior to clinical, with our thinking being if we did the testing at the start of the semester rather than at the end of the semester where it's traditionally done, our students would be better prepared in the clinical setting. Interesting thing occurred in that we found that students would test up front. They would have near perfection in their skill performance in the skills lab, yet when we moved them into a clinical setting, it was almost like starting over again. They could not transfer that knowledge from the skills lab to the clinical setting. And there's a huge mismatch in transfer of knowledge. There's been many research studies that support that. It's so critically important that we are continually having our students take that information they're learning in a classroom, learning in the lab setting, and transfer that knowledge when they're in direct patient care areas. There's also been studies out there that really support the importance of repetition in skill performance. There was a landmark study done demonstrating CPR competency, and they found overwhelmingly that if students were able to repeat that skill, even on a small level of 2 to 3 minutes every week or two, they were performing far more superiorly than they did if they learned it once and then were expected to perform it several months later. So having the ability to repeat skill performance throughout the program is going to be beneficial. We cannot teach our students to insert a Foley catheter in first semester, and they've never been back in the lab, they've never done that on a patient until their fourth semester, and now suddenly they're in a clinical area and they're expected to perform that perfectly. Having this type of a product is going to allow the student to continually refresh, continually practice, and really develop and perfect those skills before graduation. It's also important that we are tracking student performance. It's important that we are linking this information to program outcomes, and this tracking device really allows for that. It really helps at the time of accreditation where we can demonstrate the competency of our students and our graduates that we're producing. The last thing that you're going to find through this product is the importance of how it's going to transfer that knowledge from the clinical, from the lab setting, from the classroom setting, transfer that into Nclex items. We recognize that our students are struggling continually to get application analysis level questions. They're going to have repeated practice with this particular product. So let's look first at the content development. And as we were putting these pieces together, we recognized that, of course, evidence-based resources were critically important. So where the information within this application was pulled from were clinically focused journals, recognizing that the greatest specialty of skills performance is within an area of specialty. We looked at professional organizations. The Infusion Nurses Society was a great resource for us when we looked at levels of competency and best practices. The experts that are members of that particular organization really are the driving force behind best practices related to infusion therapy. We also looked at white papers, and these white papers, again, are placed and put out there by the experts, and that's what provided that foundation of knowledge for these skills. We also wanted to be sure that we were linking these skills to national and internationally known resources. You're going to find that the resources identified include organizations like the Center for Disease Control, the National Institute of Health. It's important that we're utilizing these front-running, research-driven government and private organizations in order to provide to our students very best, most current practices. Each of the skills are based on critical elements of competency, and this is very important, especially if we are testing our students on skill performance. Identifying the most critical elements are going to be so important to making safe practitioners, as well as the fact that we're utilizing the cues and competencies, and I'll demonstrate that shortly as we go through some of these skills. The SkillsHub itself has three components: learn, track, and quiz. And it's available currently on iTunes. It will be available in the Google Play Store by middle of August. So I encourage you to take a look at that, to explore that, and recognize that that's where students are going to be downloading this application from. So let's go into a little bit more detail. As we take a look at the various sections that are available, we identified 12 different sections. Main headers or areas of focus, concepts basically of skills. And within those 12 content section areas, we in fact came up with 100 different skills. You can go into each of the content areas. You can also search for a particular skill by using keywords. This particular search engine, putting in something as simple as urinary, you're going to get a list of all the skills within the Skills Hub that are related to urinary care. Some additional areas, and like I said, there's 12 different main concept areas, and then within each of these, we're going to go into the tube and line maintenance and look at the detail that rolls out. So concept area number 11 has multiple skills within it. You're going to see everything here from chest tube setups, trach care, IV therapy, NG insertion, wounds, urinary care, a whole list of different skills that are the expectation that our students have. The beauty of these skills that were chosen is the fact that they range anywhere from our fundamental students all the way through our critical care area students. This skill can also be used within a CNA program. It really has everything from those foundational pieces all the way up to the highest level of patient care skills. So as we go into the urinary care and dwelling Foley, let me show you what one of those skills would look like. And this is an example, probably very well may look similar to something that you have in your own program. It will allow the students to see in a linear format, a step-by-step process of how it is they're going to perform a particular skill. Built upon the critical elements, it was identified the specific pieces that need to be universal for all skills and especially for this skill. And certainly when you're looking at urinary care, you're looking at Foley catheter insertion, some critical pieces certainly are aseptic technique. And the way in which this can be utilized as you're testing your students is that they must meet these critical elements. If a student, even though they perform a skill perfectly, if they have a violation of aseptic technique during the insertion of the Foley catheter, then they are not successful in performing the skill. So it's critically important that they meet each of these standards within the skill. This particular skill has two different components. It's broken down for female catheter insertion as well as male catheter insertion, because we all know there's variations in those. You're going to see some skills will have a single procedure, and you have the ability to create skills that have 3 different procedures within one particular skill. If there's variations, the student can simply follow this algorithm, follow this step-by-step formula, this recipe in order to perform the skill. Each of the areas that it was built upon include the cues and competencies. So you can see the attachment here to cues and standards and how that is the structure, the foundation for each skill. This is great if you are working from a cues and based curriculum. You can utilize these concepts to recognize how it is that you're meeting your curricular needs and you're demonstrating cues and competencies throughout your program. At the bottom of each skill procedure, you're going to see a list of resources. And again, these resources are attached to evidence-based sites. They are live web links, so students can go directly to them. I'm going to show you this first one, which is a page by Center for Disease Control, and it talks specifically about the guideline for prevention of catheter-associated urinary tract infections. The thing that's unique about this is the fact that this is the most current urinary catheter article on the CDC website. And so this would generate a wonderful conversation in your lab or in your classroom. Why, in fact, is this reputable if it's a 2009 article? And I see this as an educator looking at it saying, you know what, students, let's recognize the fact that the most current information on the CDC, which is, of course, the exemplar for evidence-based practice. We trust the work that's created by that organization. But let's talk about, students, why it is that this is an older article yet the most current. Is there anything else out there that is more relevant, that is more current? Is CDC staying up to date on what it is that's best practices? So you could take this, utilize it as an assignment for your students. And what a wonderful way to connect evidence-based practice to skill performance by demonstrating to your students, okay, not only are we going to learn the skill, we're going to practice the skill, we're going to test the skill, but we're also going to look at the most recent evidence on that skill. What is best practice? The other site that we use is, or particular for this particular skill anyway, is Medline Plus, which is put out by National Institute of Health. So again, it's another great resource to utilize. And this one is more specifically identifying patient needs. So this could be utilized as a teaching site. And you could have an assignment where your students are learning about Foley catheters, they're learning about catheter insertion, they're learning about aseptic technique, and they have to create a teaching tool for a student. They have to identify discharge planning opportunities for their patients that they are going to be caring for. So again, we're utilizing these resources, very simply creating some assignments for students to stretch their knowledge base, stretch their exploration, stretch their desire to learn more than just step-by-step rote memorization of how to perform a skill. Within each of these skills, you're going to see an icon in the top right corner, and this is in fact a skill video link. So not only will your students have the ability to see the step-by-step procedures of the skill, but they also have the ability to look at a short video. These particular videos are a link to YouTube, and they were identified as the best examples that are out there. Students have the ability to view this prior to practice, prior to clinical setting. The time that I see this best utilized is maybe that student has an opportunity to insert that Foley catheter. They're a fourth semester student and they haven't been practicing since their first semester in the program, yet they can do a quick overview of this video. Within 2 to 3 minutes, they're able to visualize and see what it is they need to perform for the school, for the patient. It's going to refresh their memory. It's a great way in which students, especially those visual learners, can really concretely see what it is that needs to happen. You'll have your students that are the read-write learners that can read that recipe card and step-by-step and follow it perfectly. You're going to have other students that are going to prefer this method of learning. Other icons within the program, the bottom right-hand corner gives you the option to look at more options, more than what we've done so far, besides just a recipe card of the skill performance. Within those options, we're creating a skill log. So students have the ability to be tracking and monitoring their skills. They're going to be looking at their skills practice. They're going to be looking at their skills within lab practice setting. They're going to look at their ability to perform these skills in the clinical setting. So let's look at that tracking logging piece. This particular option gives you, the skill log itself gives you 3 different options. The top left offers our Learn option. So when a student goes into this tracking portion of the application, they are going to go through and they're going to learn the skill. You know, they're going to have the ability to learn it from the video. They're going to have the ability to learn it from the step-by-step procedure. They may even have the ability to be learning it in the lab if you're demonstrating for them. Once they recognize that they're comfortable with that, the student has the ability to track and log and confidently say, I get it. I get what I need to do with this. The second component is the practice piece, and tracking the skill log practice is exploring even further ability to apply that knowledge that they learned in the learning piece. So within that practice component, they might be practicing the skill in the lab, they might be practicing it in clinical, yet again, they're going to be able to determine, okay, at what point am I going to be most comfortable, confident with this? When is it that I'm able to move to the next level of the skill performance? The last component of the skill log allows the student to put the application into quiz mode. And with each quiz, with each skill, there are 5 quiz questions. Again, higher level application analysis level questions, and the student can test their knowledge. So what we're doing with these 3 different components is we're taking that simple skill performance, we are applying it to a clinical location. Students are practicing in the clinical setting, they're tracking it in the clinical setting, and they're relating that information to the Nclex test plan by taking these quiz questions. So here's an example of what a report would look like, and you'll see from the top of the page, this is the skill, the airway and oxygen, but just above that you're going to see learn, practice, and assess. So again, the student is going to go through and they are going to keep track, okay, what have I learned in the lab? What have I looked at in video? What have I practiced? What have I practiced in the lab? Have I practiced it adequately? And we're going to have the ability to do assessments. So those assessments might be from a quizzing standpoint. The assessment might be an instructor watching the student perform the skill. You could have clinical instructors assessing the skill in the clinical areas, and the student is then tracking this information. So at any given time, you can have students provide to you a written report or share with you electronically a report of where it is they stand in their skill development and performance. When we look at other components of assessment of the skills, faculty have the ability to sign off. So not only is the student going to be self-tracking, have the ability to self-track, but if there are particular skills that you want to have more control over, the instructor, in fact, can sign off on each of those components. So an instructor, whether it be a full-time faculty or an adjunct faculty, can say, yep, I observed this. And not only did I observe this, and of course this is a piece that is going to be secured, so students don't have the ability to go into it, so instructors would administer a pre-assigned code. But we also have the ability to determine the level of proficiency the student needs to demonstrate in order to be successful in this particular skill performance. I really like the component that we also have an open comments box. So if an instructor is in fact evaluating a student, say in a clinical setting, and their ability to insert that Foley catheter, I'm going to have this predetermined of what level of proficiency and expectation I have for my students. Then I'm going to write comments as to how they performed. We all know in the clinical setting what happens many times is that we'll watch a student perform a skill, and we are so busy thinking about the next student we need to get to that we don't adequately give feedback for the student's performance. And students sometimes feel defeated because they don't get that verbal feedback from their instructor, even if it's a attaboy and a pat on the back. They need something that tells them they did well or they need to improve. So this is a great way in which to communicate with students and let them know, okay, here's some things that I saw you could improve upon. Here's some things that you could practice in the lab. Maybe you saw a very poor skill performance in the clinical area, and now you want to send your students back to the practice lab to perform that skill more repetitively before they come back to the clinical area. These are ways in which you can track and monitor that information. There's also the ability to apply filters. We have the ability to turn on, turn off different components of the program for students. So you may have some components in the higher level semesters where students have to do higher level skills, yet we still want to be able to track of how they perform in previous semesters. So we can in fact adjust this and make it very unique to what the needs are of our particular program. The last component here that's provided is the quizzing component. And again, you'll see the instructor sign-off button here, and what that does is it allows us to demonstrate that we are tracking and monitoring the performance of our students. Again, so critically important, especially when we're looking at accreditation and demonstrating that our students are getting adequate feedback and that they're performing to the level that we need them to be performing at. So here's an example of a question, and this is going to track if the student selects the correct answer on their first attempt. So we can go into this particular program, we can take a look at it, and we can determine, okay, is the student taking this question multiple times in order to get it correct, or do they in fact get it correct on their first attempt? And this is a way in which to certainly take a look at, okay, how can we maybe assign some points? You know, could we say, okay, you need to perform at a particular level in order to get this many points? So rather than students quickly going through this and just clicking letters and retaking it, we're able to actually measure how their knowledge base is, how they apply this to Nclex level questions with their first attempt, and we're able to track that information. With each of the questions, you're going to have the student's going to see some rationale for the correct answer. So again, it's important for students to get that feedback. They can utilize this in learning mode. So they're going to take a look at that rationale and they're going to say, you know what, I get it now. I understand why it is I got that question wrong. Yet on the back side, we still have the ability to track their level of correctness. What percentile of these items are they getting correct? The filters I'd mentioned earlier, and this is an example of the screen that the instructor would see. It allows us to control, apply filters. We can determine, okay, do we want the students to be taking the quiz now? Do we want them to take it at a later point? They can utilize, maybe we don't want them to perform skills in the clinical area yet. We just want them performing these skills in the lab area until they've got them perfected. So we can turn on and turn off. We can apply these filters throughout the program that really will allow that instructor to have full control of what it is students are doing. So here's one of the unique pieces related to this program, and I really commend Skyscape for creating these individualized ability within these apps. I think a lot of times as faculty we feel frustrated because we'll purchase a particular program of software or a website or whatever, and we're really kind of limited by what it is that it provides. We are expected to change our way of teaching in which and however we need to in order to meet the needs of how that program is structured. And that's not always the best for our students, and sometimes can be very frustrating. So what Skyscape has done is given you the ability to, in fact, create and develop your own content. So what would happen is you would, as a faculty, determine, okay, what are the skills we want? What are the steps we want? Maybe this is the way in which is the best practices within our particular community. And we all recognize that there are different standards and different portions of the United States and abroad. And so we're going to be able to tweak and change things. So we as faculty decide how it is that we want to create this standardized information utilizing the same template that's already there. So it's got the embedded critical elements, it's got the embedded cues and competencies, it will have the video, it'll have the resources. And in fact, faculty can go ahead and design their own content that will be put into this application so that your students are going to see what it is that your faculty have written. And again, I see that as a very unique feature that is difficult to find in products these days. You can also create modules. So as a faculty, you might determine that there's a particular area that you're going to want to practice especially. So maybe your students have a specialty of, say, critical care, and you're wanting them to learn pulmonary artery catheter monitoring, you're wanting them to learn arterial monitoring or balloon pump monitoring, whatever the case is. You might want to create some skills in those particular areas based upon your student population, areas in which they're being hired into in the community. If those are skills that you're currently teaching and you want to continue to have that, you have the ability to create those modules on your own. So not only could you produce the skill itself, but you could also create those demonstrations, creating these modules so that students have a very individualized and unique learning opportunity based upon the beliefs and the strategies of your particular program and faculty. So I want to go ahead and open up the discussion now and see what kind of questions you have. Is there any particular area that maybe I was not real clear on you might have or your program has about this particular product?
So if you have any questions, audience, go ahead and type in the questions section and we'll answer those questions. So one question we have, Karin, is how can this be used as classroom assignments, clinical assignments, or lab assignments?
You know, that's a great question, Kristen. I had a couple of comments within that presentation talking about how those evidence-based sites could be utilized, but you could certainly use this in a multitude of ways. You know, lab time, having access to the lab is sometimes precious time, and really the ideal practices within the lab is to have students at a mannequin perform. I don't see lab time as being instructional time. You know, if we need to be teaching our students a particular skill or demonstrating it, I'm not sure lab is the best location for that. When you put your students into lab, you need to have them hands-on practicing. So you could have students utilizing these this program on their handheld device, on their, you know, their iPhone, on their iPad. They could be utilizing it through their. Students could be using these step-by-step within that lab doing hands-on practice. And then what we could do is we could have the students, maybe after they leave lab that day, complete the 5 questions. And in class, you know, 2 days from now when we bring them back to class, okay, now let's review those questions. How did the students perform on those? Is there any questions that you had? Is things that were unclear? Why is it that you selected this answer and you selected this answer? Those are great ways in which to apply various components of this product in different settings. You could have students utilizing this in the clinical setting. Say you're going to have students pulling up, and we'll use the example of the catheter insertion like what we were looking at earlier, and you can have students maybe do a compare and contrast between this particular procedure, comparing and contrasting it to the procedure within the institution. And they could look at that and say, well, you know what, this provides this information, this provides this information, and then in your post-clinical setting, in your post-conference that day, have a discussion about, okay, what does the floor nurse do? If they're looking at a resource that tells them to do things one way, and they have a particular institution policy that's telling them to utilize these steps, what are the legal ramifications? What are the ethical ramifications? How does a nurse make a decision as to which of these procedures they're going to follow? You could have students looking at those procedures critiquing. Maybe they need to look at the catheter insertion and they need to identify 3 locations within that procedure that you could have a break in aseptic technique. They need to be able to apply that knowledge to a clinical setting. You could hand them a case study about a patient situation, and you could have them working in small groups to identify how they would troubleshoot that situation. Similar to the situation that came up in the question that was demonstrated where there was a breach in aseptic technique, catheter brushed against the patient's thigh. How is it the nurse should best handle that situation? Creating those types of small case study scenarios is really going to make that real-life application to students. One of my favorite games to play in the lab setting is what I call curveball. And when students are in there performing a skill, practicing a skill, and of course it's kind of a lighthearted time, they're working in small groups, they're chit-chatting, you know, they're joking and laughing, whether it be IV starts or whether it be trach suctioning or whatever. And then you walk over to them and you hand them an index card that has a curveball. Say the student is performing trach suctioning, and the curveball would say your saturations have just dropped to 80% and your patient's having difficulty breathing. What would you do? So again, having students continually critically think of how they can be applying real-life situations into that clinical setting. So critically important. Thank you, Kristen. Are there any other questions?
Yeah, we do have a couple more questions. Someone asked, how would you introduce this to beginning students just being oriented to fundamental skills? They may not have a background in preparation for these techniques. Do you have any suggestions?
You know, that's a great question. And really, the way that these various categories are filled out, the component under fundamentals really is structured for that first semester nursing student. They are the most simplistic skills, the most common skills that you're going to see within that particular semester of a nursing program. And there's a variety of ways, you know, certainly going into the classroom, pulling up this application, having students open it. Now let's talk through how this program works. Let's talk about how it is that we can use these step-by-steps. What does this mean? What does that mean? Or maybe you could have students do a little bit of reading out of their fundamentals book and say you're talking about you know, urinary care, and so the skill we're going to go into is catheter insertion. Let's have some discussion about how this procedure would work. I want you to all watch the video, or we're going to watch the video from the classroom, from the projector, and we're going to watch it together, and we're going to have a discussion on this. So the key is not the complexity of the skills. The key is teaching students how to use the resource they have. And I think a lot of times we think of first semester students that we have to dumb things down, but that in fact is not the case. What we need to do is be teaching them how to best use the resources that are available to them and clarify questions they have. So certainly there might be some medical terminology questions that they're not clear on. Perfect. That's what we're going to be teaching them. But giving the student the onus of control over this product, I think, is so important. You know, we as instructors, and I've been in this business a long time, we like to control what it is our students do. But that is not the future of nursing education. We have to figure out how we're going to give up that control. We're going to teach our students how to use the resources that are available to them and optimize what is good resources and what are bad resources. And if we're doing that, then we're going to make autonomous nurses. There's no question about it. So thinking a little bit outside the box, not that I'm going to demonstrate this skill, steps 1, 2, 3, 4, 5, and then you're going to perform it back to me perfectly, but how do I provide that student with the resources so they, in fact, can learn how to perform that skill 1, 2, 3, 4, 5? Great question.
Thanks, Karen. So basically,
what
she talked about was how you can modularize the content based on your audience. Someone else had a question regarding, I believe it was regarding the authoring, is how you determine the critical elements when you're creating content.
Great question. You know, the critical elements is coming up with those works best in a great faculty groupthink discussion. I don't think critical elements should be determined by one individual person. So as you're sitting down with your colleagues and you have 2 or 3 faculty around a table, you start out by just asking yourself, okay, what is the most important thing that a student needs to know in order to perform this particular procedure? And when you come up with a list of 3 or 4, maybe 5 things that a student has to perform each time. And what are those? They're totally related on safety. student has to identify their patient each and every time using two identifiers. Critical element right there. Student has to maintain aseptic technique or sterile technique. Critical element right there. Student has to explain the procedure to their patient before they perform it. Critical element. And really those are based upon, I just discussed, okay, communication, there's a cues and competency. Safety, there's a cues and competency. Everything was related on safety and creating that patient-centered environment. And when you come up with those 4 or 5 critical elements, that's what your student needs to be graded upon. I clearly remember an example, and this was probably 10 years ago. I was doing, students were doing a skill performance on wet to dry dressing change. And we had a particular student that came into our program into the second semester. She had transferred from another nursing program. And so she was not in our program when she learned how to perform, how to do this particular skill. So I'm doing my skills checkoff with her. I'm observing her, and the way she laid out her gauze, her 4x4s, her sterile solution, I had never seen anybody do it that way before. It was, I just hadn't seen it in all my years of practice. And I thought, you know, I'm going to keep going with this. I'm not going to stop the student. I'm going to let her follow through, because really what's most important is, can she perform this following critical elements? Is she breaking sterile technique in the way she's performing it? Well, she didn't. She did a beautiful job. It was different than I'd ever seen anybody lay out their sterile field before, but she had not a single breach of sterile technique. She met the critical elements of the skill. She just performed it differently, and there's nothing wrong with that. So when you're looking at those critical elements, focus in on what it is that is the gold standard that every student has to do in order to be successful in a skill. And let's face it, you can teach a Foley catheter to students, a Foley cath insertion. We can teach it perfectly on those mannequins, but what do they get in the clinical area? They get a patient that weighs 450 pounds that has a fractured left hip that's in traction. And suddenly that's the patient they're going to have to insert that catheter into. And that student needs to know how to critically think by still performing the critical elements of that skill. That's what's most important. Thank you. Other questions?
Yes, Karin. Another question would be, how could a grade be assigned to this app? I think you touched on it briefly when you were talking in the presentation, but maybe some more clarification.
Absolutely. Absolutely. You know, you could assign a grade or points simply by the completion to a certain level. The ability to reach a certain proficiency level would be a way in which students could achieve points. You could put specific points depending upon how they complete the quiz questions. You could attach grades to, did they get all their practices in the lab? Did they come to the lab and practice so many times in order to demonstrate this skill? You could apply points or a pass-fail grade to their ability to demonstrate in a clinical setting. You know, and like I said, skills, we got to think outside the box. I know one example, a few years ago, we took the skills, and rather than having students test for IV push medications and IV piggyback medications, rather than having them test in the lab, we had them test in clinical. We had our adjunct faculty, in fact, observe these students, making sure they were meeting those critical elements. And when they did that 3 times repetitively in the clinical setting, then students received that passing grade for their skill performance, and they didn't have to come to the lab and skill test. For some skills, that's certainly not possible, but when you're looking at IV medications, you've got an RN instructor by your side 100% of the time. And because of that, we knew that it was safe for patients, because that instructor was in fact stopping the student if they were doing anything that was unsafe. So able to have students perform those in the lab setting, we were able to track and monitor their performance as it was being measured by that adjunct faculty. And in fact, we were utilizing that as a way in which a student was meeting a grade or meeting a competency within the course. So that's just one example of how it could be utilized.
Thanks, Karin. We had a
other
couple other questions here. I'll try to answer them. You can put some feedback into them as well if you'd like. One was regarding the strategy to expose faculty to this program and get their buy-in, and what's the time frame. We found at Skyscape, at least, that for faculty to buy into this program, it always helps to have a champion at the school. Where it is now, the students can download the app and test it out. You can too. So the buy-in is also dependent on whether your faculty, likes technology, and we are moving towards, we're in a technological world right now. The system was designed for ease of use, so basically if you can send an email and type, you pretty much can use the system. We also had a question about the cost of this program. Now, the app is available in the iTunes App Store right now and will also be available in the Google Play Store. Right now, it's free, but it will be, that'll be changing in the near future. For the authoring tool, will be a nominal institution fee and a per student fee. It'll be based on the size of your institution, and if you are interested, which we hope you are, you can email sales@skyscape.com. Did you have anything to add about the ease of use of this, Karin?
Well, excuse me. I completely agree with you. I don't think that there's a more simplistic program out there. There's no question that students are going to attach to this very quickly. Faculty, because of our age, oftentimes we might have a little bit larger learning curve, but I agree with what Kristen said. Identifying that champion is going to be a key important piece. The other thing too is getting it into somebody's hands. So I know we had some great buy-in with our faculty a few years ago by taking some iPods that had some of these programs downloaded on them, and we said, you know what, take this, use it, play with it. And once they saw the value in it, it sold itself. And I think that's the importance. A lot of times your naysayers will sit with their arms crossed, yet they're not even willing to turn the product on or give it a try. If you can at least get it into their hands, let them try it and see the value in it, that's a great way to make it happen. Also, if students start utilizing it, then they start demanding it. And a lot of times faculty are forced into following suit because of the drive of students. Students want it, they demand it. And so faculty are feeling like they're being lost in the dust, and a lot of times they'll jump on the bandwagon just because students are making them jump on the bandwagon.
Okay, thank you, Karin. One last question, just to reiterate maybe too, because I know you did touch on this, is how you can use this to document student progress, demonstrate program outcomes. We have.
Absolutely. Another great feature that this offers is the ability to create a report. So students or instructors are able to have a summary report of each student's progress and performance. That could be utilized in certainly a paper printout mode. It could be utilized in electronic mode. It can be shared. So you can have this information that is being shared with instructors, shared with fellow students, however it is you chose to design this and roll out the application of this product. But those are great identity components. Making sure that within your curriculum, as you're looking at your program outcomes, as you're looking at your course outcomes, your course competencies, you want to make sure that you are correlating this information. Skill and skill performance should not be this huge outlier. It needs to be woven throughout our curriculum, just like oxygenation is. Students and faculty really need to make sure there's a clean line between what are the expectations and how it is students are demonstrating that. And again, this gives a very concrete record that we can show demonstrating how it is our students are meeting course program outcomes through not only skill demonstration and skill competency, but also through skill knowledge with the correlation to the quiz questions that are out there. So I would encourage you again to explore those components further because they're very valuable for program accreditation.
Thanks, Karin.
Are there any other questions at all?
Nope, there was no other questions at this moment. If we didn't get to your question and you have further questions, please feel free to email us at webinar@skyscape.com. What I'd like to tell you a little bit more is about what Skyscape has to offer. As you know, we've been doing in the mobile app sphere for over 20 years, and so we have a galaxy of resources and tools. The main one we have is the Skyscape Medical Library, which gives you access to textbook content, over 400 titles from 30+ publishers, which are integrated in one easy-to-use app. This is by far more than any other publisher or vendor has. We also have a free app that you can try if you haven't tried it already, which gives you a calculator, a clinical reference, and a drug guide for free. We also have our Nclex question of the week, which is a web-based question platform of Nclex questions that are attempted by thousands of students weekly. It's also available for use within your group. We have NTrack, which is a clinical log system. It's an online tool that will rid your faculty of paper burden with paperless clinical log and skill tracking system. We have SnapWord, which is a fun human anatomy word game that includes over 100 beautiful images of the organ systems, skeletal systems, and muscular systems, with more to come, and that's in the App Store. Flash Drive is part of the Galaxy that allows you to share and store documents. And SkillsHub app, as you know, is a mobile app to learn, track, and quiz assess nursing skills with step-by-step instructions, videos, tutorials, and related Nclex type questions. It's available for iPhone now, and we will have it available for Android in mid-August. I'd like to thank you all for attending today's webinar. This webinar was recorded and will be available to view or share later this week at skyscape.com/webinars2015. For questions or more information about SkillsHub or any of the tools in the Skyscape Galaxy, please email webinar@skyscape.com. Thank you and have a wonderful afternoon.